Hi friends, welcome to our podcast series from CSI West Bengal branch. I am Dr. P.K. Hazra and being joined by my good friend Dr. Soumik Chaudhuri from Peerless Hospital. Welcome Dr. Soumik.
Thank you, sir.
And he is very elegant cardiac physician, interventionist, ICU specialist, and he is leading the Peerless Cardiology program for a pretty long time. And can you just introduce yourself to the audience, Soumik?
Yes, sir. Hello, sir, and it's always a pleasure to be with you. I'm Dr. Soumik Chaudhuri. I'm working as a consultant cardiologist. I'm currently the clinical lead of the Department of Cardiology in the ICU in charge at Peerless Hospital, Kolkata, sir.
Right. So today's topic of discussion is abnormal beating of the heart.
Absolutely.
Heart
sir.
is very important organ for cardiologists.
It is, sir.
Not only for cardiologists.
For everybody.
For everybody.
Yes, sir.
And when it goes in rhythm, everybody is happy because you don't get to know whether you have heart. But when it goes bizarre, like in terms of the arrhythmias.
Yes, sir.
So how do you understand or how do you communicate with the patients when they come to you for their abnormal pulse or abnormal heartbeats?
Absolutely, sir. What happens is a lot of people are extremely aware of diseases like heart attacks, heart failure. But there's a very strong group of diseases called arrhythmias, which are the heart rate irregularities. Now, a normal beating of the heart, as we know, the heart has some chambers at the top called the atria on the right and the left, and the ventricles at the bottom on the right and left as well. Normal beat, an atria beats, the ventricle beats, and there's a signal that goes through. But this signal can go completely haywire at times. The atria beats multiple times, the ventricle doesn't beat at the same time. They have completely disjointed themselves from each other. And what happens is the patient starts developing a feeling of palpitations, a feeling of irregularity in the beats. A very common point here is, I seem to be missing beats. I seem to be having...
They feel here.
They feel here, sir. There's something irregular here. Doctor, it doesn't feel right.
So don't feel here.
They could, sir, because one of the biggest problems that we have with irregular heartbeats like atrial fibrillation is that by far they are the biggest causes of stroke, sir. And this is something that...
Also, they can lose their consciousness.
Yes, sir, they could. A lot of times they feel extremely dizzy, they are lightheaded, they could fall down. And we find that arrhythmias are causes behind them having these symptoms.
So these are called arrhythmias by doctors?
Absolutely, sir. Arrhythmias or heart rate irregularities.
So what is the commonest cause of this kind of abnormality?
Sir, a number of reasons could be there. It could be due to heart attacks, as we sometimes say, but aging, as the process of aging by itself causing the structural heart disease, can cause arrhythmias. We could have it due to hypertension, especially blood pressure, which is not well controlled.
So that is atrial fibrillations?
Absolutely, sir. Atrial fibrillation remains the commonest among them.
Commonest among them.
Yes, sir.
So you can have, similarly, if it is atria, we can have ventricular also.
Yes, sir, we could.
So ventricular fibrillation is much more devastating and killing disease than...
Oh, yes, sir.
Is it equal to ventricular fibrillations? Or it is as bad as ventricular fibrillations?
In some ways as bad, in some ways maybe a little better, sir.
So it slowly kills?
Yes, sir. It slowly kills and it does worse than that sometimes, sir. There are times when people develop strokes due to atrial fibrillation and they get paralyzed. It's not just the life mortality that we talk about, but even the quality of life that comes after that is absolutely devastating for them.
So once atrial fibrillations, always atrial fibrillations in lifetime or?
Not so much, sir. There are some different types. There are some diseases, some subtypes called the paroxysmal atrial fibrillations, and which are actually notoriously difficult to diagnose sometimes because this heart rate irregularity, it comes and it goes.
But the disease remains there. The pathophysiology or pathology
remains. It is a disease that can be controlled, not cured.
Okay. So that means it is a lifetime story.
Absolutely.
And all patients should come to the physician, cardiologist, get themselves checked up.
Yes, sir.
So what are the tests we advocate to diagnose this kind of abnormalities in the heart? And how do you console the families, their friends, their wives and children, their parents, that it is benign, it is malignant, or it is semi-benign, semi-malignant?
I think I would firstly put it somewhere in the semi-benign and semi-malignant. I think the simplest investigation that we have is something that's available almost everywhere is a simple ECG.
Okay.
I think that's one of the very important things that should be done right at the beginning. However, I think in times of good change that are coming, a lot of our patients are now wearing smart devices.
Right.
They're wearing
watches.
Yes, sir. These watches are extremely useful sometimes in picking up these arrhythmias, even informing the patient that there's something wrong. Now, obviously, it needs to be checked by a doctor. It needs to be checked by a cardiologist.
Yes.
But that initial screening, the reason why the patient comes to the doctor in the first place could be a smartwatch.
Yeah.
So I think that's something that's been a really good boon in diagnosing these kind of arrhythmias.
So is there any danger of overdiagnosis by your Apple wristwatch or wearable devices?
It may, I would any day err on the side of overdiagnosis because we will
Then
be confirming, then
underdiagnosing.
underdiagnosing. I would not want to lose one patient of atrial fibrillation because I know where it could reach after that.
So your oximetry at home or wearable device
Absolutely,
or your
sir.
home monitoring
Yes,
can
sir.
give some ideas that
Absolutely.
you are suffering from a benign form of abnormalities, arrhythmias,
Or something which is much worse.
much more
Absolutely,
worse.
sir.
What are the implications of having atrial fibrillations at early age, at middle age, and in advanced age?
One of the, I would say the prime causes of having atrial fibrillation in the early age probably could be associated with toxic substances. Alcohol remains a very common cause. In fact, there's something, if I take some time, sir, there's something very interesting called the holiday heart syndrome. Now, what does it mean? There are a lot of times the patients come to us, they have been binging over the weekend, and the next morning they're having a severe palpitations and their heart rate is extremely irregular. This is actually a real thing. It's called the holiday heart syndrome. When people, young patients, especially they binge on alcohol, it can sometimes trigger atrial fibrillation in such patients. So we ask them to moderate, cut down, and explain the lifestyle changes. However, when it's the elderly who comes with atrial fibrillation, it's usually a persistent atrial fibrillation that occurs due to the structural changes that occur at that age. Hypertension is a very, very strong, potent risk factor that precipitates this. And even things like diabetes or other endocrine disorders which are not well controlled.
Endocrine thyroid disorder.
Thyroid disorders. These kind of things can very well also precipitate atrial fibrillation. So taking a good history is also important to understand whether the patient is
And snoring, you mentioned about.
Obstructive sleep apnea, sir. It's very underdiagnosed, but thankfully these days more and more patients, there are a lot of people who talk, I snore a lot at night and they think it's benign. It's not so much. It could be one of the first markers of them having obstructive sleep apnea. Simply put, they stop breathing at night.
Are there therapies for your snoring?
Yes, there are, sir. There's something called CPAP machines, which are excellent devices. They not only improve your sleep apnea, they also improve your mortality because it's a very important cause of sudden cardiac deaths. So we have devices which are available, which bring down this issues of atrial fibrillation, patients of sleep apnea, and also help to prolong their life.
So right, so if one patient comes to you with a diagnosis of atrial fibrillations, diagnosed by his physician,
Yes, sir.
and he has come to you for your advice.
Absolutely.
So what are the things you should advise to these patients?
I am going to be looking at two very important parts. My one part would be to try to control the atrial fibrillation per se. So there's something we call rate control. We try to bring down the...
So racing of the heart.
Racing of the heart, we try to bring it down as much as possible. So we give medicines for that, which bring down the rate. Not so much as it causes problems for them, but at a good place. The other very important point that I have to prevent are strokes. Because atrial fibrillation causes small clots to build up in the heart. They can get thrown up to the brain. People can get massive strokes. So blood thinners, we call them anticoagulants. They are extremely important in the management of atrial fibrillation. And these days, we are lucky. We are living in a generation, we are living at a time where we have got some excellent new blood thinners which have excellent potency, benefits, but the previous worry that people used to have that they had high bleeding risks have come down substantially now.
Right. So if you are having a patient on oral anticoagulant or blood thinner, we call them NOAC.
Yes,
and there are three forms like afogatran, dabigatran, apixaban, and rivaroxaban.
Absolutely, sir.
These are very safe drugs nowadays, and it has to be continued lifelong.
Yes, sir.
Now, if somebody gets a stroke and he goes to neurologist, do you think that neurologist should have a conversation with the cardiologist to treat them better?
They obviously should, sir, and thankfully they do. In fact, a lot of times, and I'll tell you this, sir, a lot of times the patients of atrial fibrillation do land up with neurologists first because what happens is, unfortunately, they have the stroke first. Then retrospectively, the atrial fibrillation is diagnosed. So a good communication between the neurologist and the cardiologist is very important because that stroke that has occurred I cannot prevent that, but I can prevent further strokes from occurring in that patient. So it is important to diagnose a patient even after the stroke has occurred so that recurrent events can be prevented, the quality of life can still be improved after
So
that.
what are the main symptoms of a stroke? When a man comes to know, the patient comes to know that he has a stroke.
There'll be a sudden, sir, the worst part would be there'll be a sudden paralysis. There will be a sudden drop in the power of one side of the heart, or one side of the body. They could have drooping of the side of their mouth, difficulty in speaking, slurring of speech. They could become unconscious.
Change of behavior.
They could have altered behavior. These type of things. The most devastating remains the paralysis. And there's one very important thing. Sometimes, rarely, these symptoms might come and go.
Right.
So it's very important to diagnose those as well, because they might be the absolute warning signs that something bad might happen just around the corner.
Right. So that means what you are telling me and the audience, that the stroke should not be taken lightly.
Never, sir.
Atrial fibrillation should not be taken lightly.
Absolutely.
It's a lifetime disease,
Yes.
unlike ventricular fibrillations, VT, where you have a device, and one VT, you have a device, you never had VT in your lifetime.
Yes, sir.
But once you have an AF, it is almost always AF again in your lifetime. And it can cause strokes. We need to have a discussion with the neurologist to come to a complete conclusions that these are the medicine which is safe, effective, and can prevent further strokes. Now, imaging, very important tool. We call these things are imaging. It is CT scan, MRI. So what are the other things which can tell us and go deep inside the heart? Echo, you have mentioned, the ECG, you have mentioned, the chest X-ray, these are the common things.
Absolutely, sir.
Is there any scope for invasive imaging in this group of people?
There's something called transesophageal echocardiography. Now, why is transesophageal echocardiography? A normal echo is done from outside. It's like an ultrasound of the heart, as I explain it to my patients. A transesophageal, it goes from inside. Basically, it goes down the gullet. And what it actually sees is the fact that there are some areas of the heart, especially the left atria, the top chamber of the heart, where the clots form, where the clots get stored, and then those clots get thrown to the brain. A transesophageal echocardiography is very important in diagnosing those. So every patient of atrial fibrillation should ideally be getting a transesophageal echocardiography to find the clots.
So that means you are saying if you know that there is a clot sitting inside the heart, and the patients are suffering from atrial fibrillation, is a kind of emergency. If it is a large clot,
Absolutely.
it's an life-threatening emergency, because you can die, your heart can stop, your brain can choke, you can get paralysis, and there are medical therapies, there are device therapies like LA closure device, those who cannot tolerate these drugs. What about that EP specialists know that they have a significant role?
They do, sir. In fact, their role is going up and up. There are catheter ablations, as we call them. The question has always been, do we try to control them? Do we try to control this disease? There are a lot of people who stood up and said, why don't we try to cure this disease? Why don't we try to burn off those areas, if I put it very lightly, so that the places in the heart, in the atria that are triggering these beats, these irregular beats, they could be completely eradicated. So catheters, devices, ablations, electrophysiological studies for atrial, I think they are coming up significantly. Probably in the future, they could even become the standard of care in atrial fibrillation patients. It's something that is being done. Maybe it needs a little more time for it to be accessible to everybody, understandable to be understood by everybody. But it's something that's definitely in the future for atrial fibrillation.
So that means they should have a consultation with the EP specialist.
With an electrophysiologist,
Electrophysiologist, this is subspecialty, super specialty rather.
Yes, sir.
Now, in our last podcast, we have discussed about the various types of pacemaker. Do you think the incidence of atrial fibrillations is higher with a single chamber versus double chamber pacemaker, or it's a myth?
I think the jury's a bit out on that one, sir, yet. Probably there has been historically data on that. But I think with more and more refinement of data that's coming in, it may not be so, numerically they might be higher, but it might not be statistically so significant, sir.
Right. So, Soumik, you have highlighted the need for wearable device, ECG, imaging, awareness, prescribing good medicine, safe medicine at early period, and continuation throughout life, the devices, ablation, LA closure, a neuro heart team approach like thing. And what is the one message you want to give to the audience about this arrhythmia as such, as a whole?
Don't ignore. Don't ignore simple symptoms like palpitations, symptoms like you're missing a beat, symptoms like you're feeling lightheaded, dizzy, maybe you're getting a feeling of lethargy which is unexplained. Maybe at the end of the day it might be nothing. It might not. But I would always have you err on the side of over safety than under safety.
Okay.
So get it checked out.
There is a recent concern of thrombosis, with COVID vaccines,
Yes, sir, TTP,
So
it has now...
How can you alleviate the fear of having thrombosis due to Covishield vaccine from Pfizer in today's patients' population? Like we have received Covishield vaccine.
We all have, sir.
We all have,
yes,
doctors have received.
I think what we need to understand is a percentage. The number of such events as compared to the number of vaccines, your probability of getting it is very, very minuscule. Secondly, I think what I have learned going through the data, the time period has been vast since then. If God forbid we had to have it, we would have already had it. That period has gone. Yes, it's something that definitely, in a way, it's good and bad, the fact that we got these vaccines within a year of the disease. The bad thing is, vaccines take a long time to develop.
So that means it has saved millions and millions
of people
saved
much
from
more.
death.
I think it's a very small part.
Very small.
That's
So
very minuscule
people
part,
should
sir.
not worry about
Not at all, sir. Not at all.
Thrombosis due to COVID vaccine in atrial fibrillations. Those who are taking medicines, oral anticoagulant, no need for panic. And we have almost come to the end of our discussions today with Soumik Chaudhuri, Dr. Soumik Chaudhuri. And in this podcast, we have highlighted the need of the hour is detections. Atrial fibrillation is the commonest arrhythmia, abnormal beating of the heart. It can affect many organs, mainly your brain. The same clot can go to your hands,
Yes.
can go to your kidneys, can go to your other organs, even to the heart.
Anywhere.
So this clot can migrate, can travel with your speed of the blood, with time, and it could be devastating. So if you have these kind of symptoms like paralysis, salivations or deviations of angle of the mouth, loss of consciousness, sometimes you need a pacemaker also in atrial fibrillations. So all these are available in Kolkata, in Eastern Zone, ablations, devices, therapies, sincere advice. Prognostically, it can change the whole scenario of living longer. It's not so much devastating anymore. Drug therapy and newer technology, newer medicine has completely changed the paradigm of treating atrial fibrillations. It can again add life to your years and years to your life.
Absolutely.
With that, I'd like to thank Soumik
Thank you, sir.
for coming here and joining the podium for betterment of humanity. Thank you very much.
Thank you.